Amazing. Cool. So we'll dive in. Mandy, if you can give a brief intro about yourself and a little bit of your background so that everyone knows who we're talking to, I think that would be a great start.
Sure, absolutely. So my name is Mandy Patterson. I am a naturopathic doctor and a functional medicine practitioner, and am in the space of helping women with hormones and infertility. I have quite an extensive background in the healthcare industry. Initially started out as an occupational therapist for many years, actually been an OT for 22 years, and transitioned over into the holistic wellness space about 12 years ago, and started helping people from a uh, oh more of a role of being health advocates for themselves, and just trying to understand their own unique bodies, and how we can help from a functional side of things. So it's a bit about me.
Amazing. And glad to have you on the interview. Excited to talk to you. Obviously, I know Mandy. We've been working with her for a while, and she has some unique insights. So I'm excited to hop on and dig in. I wanted to start with, I think you have kind of a unique story on how you became Mandy Patterson. So can you tell us a
Yes.
little bit about what happened with your grandfather when you were growing up and how that really shaped where you went with your career?
Yeah, sure. So, when I was 5, my grandfather was in a really serious accident that left him as a paraplegic. So he went through a very, very long journey of rehabilitation, and had health issues for years afterwards. And so, as a young child, I had a keen interest in the medical field, and just realized that was really where my passion was as an individual. So even going into high school, like I knew I was going to do something pre-med or even physical or occupational therapy. It ended up choosing occupational therapy my senior year of high school. I actually got directly admitted to a program over in St. Louis at St. Louis University. So did my undergraduate degree there. And so that's kind of what started me into the medical field. And then I've gone on to have six children. And that even my own children's health experiences and challenges, including our own family's experience, have allowed me to continue to evolve as a medical professional. And part of even the like how I got into the holistic world was my oldest son was born at 28 weeks, weighed a pound and 14 ounces. Ended up with a gut infection that he needed an ileostomy for a period of time, and ended up having really significant gut issues. So that kind of set me on the path towards trying to figure out how to help him. And also, I recognized a need very, very early on in my healthcare career, that it felt to me that we were just putting band-aids on people's health challenges. And, I would get so many frequent flyers because I worked in the hospital setting for many, many years. Actually, just resigned last year, but worked in subacute and acute care, and had many people that would come in with certain health challenges. We would rehabilitate them and send them on their way, but then they would show up 3 months later down the road. And I was like, there is definitely got to be a better way here to help people. So that's how I started out with my own business in health consulting and entrepreneurship. So,
Amazing, amazing. I want to dig in a little bit more on your upbringing. Obviously, you had a knack for wanting to help healthcare. That grandfather situation might have been a catalyst. Tell me a little bit about your household. Were your parents very accommodating? Were they caring people? Because it feels like you have that energy from an early stage, and I was kind of curious to see if it stemmed from the household or maybe it was something else in addition to the grandfather situation, which was
yeah,
unfortunate.
absolutely. Yeah, I like my parents are amazing. Like I grew up in a family where my dad was an engineer and was an entrepreneur as well.
Nice.
Had his own business from the time I think I was like 5 years old. So he did consulting in the electrical and mechanical space of engineering. And my mom was a stay-at-home mom. So I was the oldest of four kids. I have three brothers that are younger than me. But my parents were always amazing at like just being there for us, very, very supportive. And we have a really close family unit. So that's
Mhm.
been, a huge piece of my background and even in my own family and the way we approach things. So yeah, so that's yeah, you're right. You're onto that when you ask, and actually my parents are still very involved. We live in the same town, so they're involved with my kids and um yeah, so very blessed with that.
Amazing. I'm curious, given America's culture with food and dietary guidelines, what was eaten in the Mandy Patterson household when she was, a little girl and growing up? Like, and
Yeah,
has that
I
changed
was like
given, over the
yeah.
years of what
So
you're
like
doing?
I mean, my birth year was 1980, so like, that definitely the 80s were, the jam with like, just like America and the way things were. My mom being a stay-at-home mom, she was great. She made a lot of like casseroles and like, I ate a lot of the standard American diet, which ironically years down the road, my mom had several different autoimmune diseases that
Mhm,
she's had to figure out herself with a functional medicine doctor too.
mhm,
So, and yeah, it's that really permeated like our family. And we started realizing very early on, which is why I've gotten into the field of nutrigenomics and genetics when I coach people and help them um, figure out their unique identity and who they are. But my mom had to go down that path, and also have a brother that is very open about speaking about mental health issues. He's had
mhm,
depression and anxiety over the years. And we figured out as a family that what we were putting into our body, what we were putting on our body, really made a huge difference in our optimal functioning. And my one brother, who is the one that struggles with depression, anxiety, he's a big biohacker. Like he's into doing Wim Hof,
yeah,
cold immersions. He does floating. He does, he really gets into things like even Dr. Huberman, like learns from him. And so, yeah, so it's kind of funny how it's evolved over the years. But yeah, I mean, I grew up on Ritz crackers and teeny cornies and fudge rounds and all that good stuff.
mhm,
But for myself, like my health crisis came when my oldest was born 21 years ago. And I developed severe preeclampsia and HELLP syndrome, which is basically kidney and liver failure.
mm,
And the medical community couldn't figure out why that happened. And so they, kind of gave me the worst case scenario that I wouldn't go on to have kids. That if I did, I would probably have many miscarriages. And I just could not accept that as my reality. So started down the path of really figuring out for myself, like I've got to figure this out because for me it was life or death.
mhm,
And I think when you have an experience like that, it really does push you to find the truth, you
mm,
know.
yeah.
So
That's an interesting, I want to dig into that a little bit in terms of what you just said, which was I didn't take no for an answer. It was the undertone. You said it more elegantly and in a better way, of course. But why do you feel like you push through when others don't? They just take that as a baseline answer and then they're like, okay, I guess this is what I'm living with. Like, do you have a moment or is it all the experiences throughout your life that you've like, was there anything in your inside of you that kind of said, you know what, I don't really agree. I got to find my own way and I'm going to do it no matter what. Like what drove that from you?
Yeah, I think for those of us that are born into advocacy and activism, which at this point I am in that space from even from a legislative side of things, looking at what's going on at the state level and even national level as we work on healthcare legislation, I think I do have a unique lens. So I have the lens in being the patient and being the recipient of, the healthcare system, our broken healthcare system, which I must say.
Mhm.
And then I also have that other lens in advocating for other people, in really having them find their voice and step into who they are. I think that is a problem that I have with our healthcare system is that I really feel like people are bullied. They're not empowered. They're basically told this is the only way that you can do this. And, you have to do it this way. And I've always been, I guess, a rebel without a cause, like really. And I'm like, nope, I'm not doing that. And I think part of that is just born out of my own identity. My dad was much the same way as an entrepreneur. And I'm very strong willed and I know that there's other ways. And so I think that's what really propelled me forward. Even in addition to, um, three of my kids have really significant learning disabilities. And it's a language and visual processing disorder that all three of them have. It's my first, my third, and my sixth child. And unfortunately, they don't fit. The one fits in the box of the ADHD diagnosis, but the other two don't.
Yeah.
And so we have had to fight tongue, tooth, and nail to get them the accommodations that they need so that they can learn. And, my kids over the years have been in like all sectors of the educational system, from public to private to we've done homeschooling. We lived overseas in Australia for 2 years. So, got to see like how other people live outside of the US, which was very important. But yeah, it's kind of like all of those things coming together that make me passionate about who I am and what I do in helping people. So
Amazing. Yeah.
yeah.
So that's interesting. You mentioned healthcare is broken and that people are bullied into doing things. Why do you think that is?
Yeah, I think that this goes back like a generation, like, where, even when we like, being born in the 80s, and kind of on the cusp of that millennial like generation, initially, like I remember my pediatrician, he like ran his own practice with another partner. But what we've seen over the years is, big industry buy up all of these doctors that used to make their own rules and choices and run their own businesses, and now they're owned by a much larger entity, and so that there is this trickle down effect. And honestly, it's gotten so big that I don't think that the best interest is in the patient or in the name of the patient. A huge part of what drives healthcare is money. Let's be honest. So, and we
Mhm.
see that in the pharmaceutical industry, and there's even been a term for the medical industrial complex. And I think we've really seen that roll out over the last 3 years, even with COVID and the way COVID was handled. It was highly politicized. And that's where, I really help people to kind of peel back the layers of that to really understand. This goes back many, many years. It didn't just happen overnight. And being a healthcare practitioner since like that would have been 2002. I mean, I have seen massive shifts, like, in the hospital system, and I've worked in assisted living, and I've worked in early intervention out in the community. Like I've really worked in all sectors of my healthcare industry. And, that's part of my own impetus to like leave. I left last year. I finally resigned after 22 years of being an occupational therapist and decided that my time was better spent educating, inspiring, and empowering people to be their best versions of themselves. So,
Mhm. Yeah, that's interesting. I'd love to spitball with you on this. doctors sign the oath, the Hippocrates oath, do good to the patient no matter what, right? So that's kind of the, let's say, guiding principles that every doctor abides by as they become a doctor and on that journey. What's your opinion on, and I agree that smaller practices are going away, doctors are going to larger hospitals, they're in an ecosystem.
Yeah.
There's other aspects of that which we might get into, might not, but I want to stay on course, which is like litigation is a huge problem, right? So, and then the
Yeah.
cost to become a doctor has skyrocketed, but their salaries haven't really gone up exponentially as much as their costs. So it's kind of
Right.
easier to be part of the bigger ecosystem. And, if you're a single practicing get sued, that's a much larger problem because the backing isn't as big and the lawyers aren't there. And, it could have been an honest mistake. Humans are humans. So what I'm trying
Absolutely.
to get at is, do you feel like they want to do good, but they're in the confines of, I'm not allowed to go outside of the scope of these guidelines. And so even if I said something outside of these guidelines, if they do it and it goes wrong, I might get sued. So therefore, I'm going to protect myself and I'll do this thing that I'm supposed to do. And, I'm also tired because I see 100 patients a day or whatever it is. Right. Is that
Absolutely.
is that kind of how you see it as well, or do you have a different opinion
I
on?
I do. I really firmly feel that most people go into the healthcare industry to help and heal people. I really do think that that is most people's intentions. Like they're givers, they're healers. They want to help, but for whatever reason, we get caught up in the system that I know, even speaking from experience with my own friends that are still in the system, there's many of them that are physicians, that are therapists, that are nurses. Um, they tote the line because their livelihood depends on it. And unfortunately, and you would understand this, when you have a licensing board that comes after you and threatens to take your license and your livelihood, that is huge stakes for people. And I think that's where we've even seen why, we've seen this like pattern of censorship over the last 3 years for people that, are out there trying to do good. They're being censored. Honestly, I feel like there is an undercurrent of dividing us as human beings all over the earth. And I do think that at the heart of it, that's what's really going on, unfortunately. So it's unfortunate. And I do think, there are people that are just in it to make money, let's be honest. Like, but I do think the majority of people from a Hippocratic oath go in and like they want to help people, that's their aspiration. So
Okay. Yeah. And we won't stay on this too long. We have some other answers, and you've been so good at going thoroughly through them. Um, what's kind of your opinion on this divide? Where do you feel like it comes from personally, and why do you feel that way?
yeah, I mean, yeah, this is like a whole rabbit hole we could go down.
Yeah, we'll keep it
I
high level.
Yeah, we'll keep it high level. And just to highlight like my thoughts is like, we have these much larger world and even oh organizations like such as the FDA, the CDC, and all of these, organizations that are out there. Generally in the past, we felt like they're good and that they have the people's best interest in mind. Unfortunately, I think what we've seen over the last 3 years is a shift in that, where we're not getting information that is important for us to be able to make the best health decisions for ourselves. And so, that is something that even I'm working on in my community and on a state level, in them hearing us speak, those of us that have been in the trenches for years, that know what optimal health looks like for people and how people should be treated, and supported in making the best decisions for themselves and their families.
Mhm.
So I think it is a much higher up the food chain kind of thing that we've seen. And it's the trickle down effect. And so that's where I think that people need to understand. It is important to speak out, and attend meetings if you can at your local, like your school board and like your city council, and like I'm speaking in at my capital, like the state house. Like all of this matters, and it matters for future generations and our children and grandchildren. So
Gotcha. And this is an interesting topic that I talk to a lot of people about because there's so many differing viewpoints. I'd like to kind of spin something your way and see where you land with it in terms of how you see this, how this all has unfolded, right? Because one train of thought is, look, a lot of doctors I talk to, look, patients just don't do what I tell them, right?
yeah,
We could
yeah,
tell them all day long, come in, have you tried diet, exercise? No, I don't want to. Or yeah, but then clearly they're not. And so it's kind of like there's this whole industry which has been built, I think most people will agree, that has made food really addictive, not necessarily good for you, but it tastes great and you want to
yep,
keep eating it because then you buy more product, right? So this is just, we're not trying to politicize food or that industry. I'm just saying on a business level, when you create products, you're trying to make them so that people will take them in, right? Unfortunately, like now we understand there's lots of studies that have come out that show this isn't great for us long term, right? Maybe once in a while, but the problem is it's so addictive that it's the once in a while can become binge eating, and then it's a addiction just like anything else, etc. So I think on a
yep,
surface level, anybody watching this can see that viewpoint, right? And so then you have these doctors who just say, to actually change these behaviors, there's a lot of things that are going against these people, right? So as soon as they're out of my office, marketing here, marketing there, at the store, the colorful things look great. The children want that because it looks good. The marketing is on point, and then it's the family unit doesn't really agree. They don't actually talk together. So there's all these like underlying factors that would make health successful or not in a household where the doctor is just like, I'm just burnt out because they all come in, majority of people. So there's obviously like your brother, like you said, is a biohacker. So that's like a small cohort of people that will do whatever they can to get healthy, right? And then they're
yep.
like, so then what it comes down to, the point always is, what's like the biggest impact thing that if everybody did, we're getting somewhere, because this longer term stuff is just going to take forever. And to be honest, most doctors that I talk to that are either in a hospital or private practice, a lot of them behind closed doors tell me, we're just trying to get by during the day, like we have no
Absolutely.
time, to do these things. And sometimes I've been more studied on a certain topic than one of my doctors. And they're like, where did you get, like, where do you find the time? And it's like, they don't even have that time, they're like
No,
busy and tired. So do you see that as like something that's gotten worse, progressed? Do you agree with that viewpoint
I
that's
I do.
necessarily comes out? Yeah.
Yeah, I can really speak to this. So I'm on a local board that basically coaches physicians in our area,
Hmm.
in wellness and lifestyle factors. And I just had a conversation with a physician. He's a hand surgeon like 4 months ago. He's super burnt out, especially post COVID. He was like, I've got teenagers at home and a wife, and like I think they've had some family things come up.
Hmm.
And so we were talking through things because, like, whenever I have discovery calls with potential clients, like, I kind of give them, try to get a gauge on where they're at, with 10, like, being like, I'm all in on lifestyle changes, dietary changes, all the way down to one, like, not there yet, maybe contemplative or pre-contemplative um part or phase. And he said to me, he was like, I hardly have time to go to the bathroom like during the
Yeah.
day. I don't have time to eat. He was like, I'm a hand surgeon, so I have to be very, very careful about the exercises that I do and all of these things. But the moral of what I'm trying to get at is, like, he was so overwhelmed. Like, he
Yeah.
didn't even know where to start. And
Hmm.
like this for us, like you said, we're in this industry, the wellness space. So like we get, obviously our nutrition is big, our exercise is big, our sleep is big. All of those things are very, very important. But for physicians, they are on that circular, like mouse, like rotary thing where they like literally just can't get off. And they have like so many pressures and stress. And so that's where I am really passionate about physicians, like, like they need support, and we've created a system that does not support them and is
Mhm.
not in their best interest. So and it is becoming an epidemic, and I really feel like over the last 3 years we've really seen that. So yes, so very important thing to address and talk about, like in our communities and our circles.
Mhm. Okay, cool. Yeah, I get that sentiment a lot, which is why I like to bring it up because as you know, anything can become very polarizing, like, oh, like see, doctors are not out to help us, or like there's no use to them or whatever. It's like the context I feel like always helps, especially with somebody such as yourself who's been in the industry for a long time, who sees it day to day, right? To kind of say, this is actually what's happening. So,
Yeah. Yeah.
let's have a perspective here that where we can try to figure out pathways forward.
Yeah,
Um,
and we're actually working on that in our community here. So this board that I'm working on, we're looking at some upcoming wellness events where there'll be speakers for the physicians to come to so they can get resources and make connections. And we also have some mental health professionals that are on the board, a psychiatrist, and some other people that are just really supportive around health. So I'm hopeful that this next year is going to be really good for our community and our physicians, because we basically cover 3 different hospitals here locally in Indiana. So
awesome. Very cool.
yeah.
Okay, I want to shift a little bit more into what you're doing now, current modern day. You mentioned hormones and infertility. Why has that been an area that you decided, or maybe you fell into, we'll find out. Why are you in that scope of helping people in that specific category of health?
Yeah, absolutely. So, as I kind of discussed before, after my first son, I was basically given that doom gloom outlook that, for whatever reason, I probably wouldn't have any more kids. And if I did, I would have a lot of miscarriages. They did all kinds of testing on me, tested me for lupus, tested me for antiphospholipid syndrome, which are two different disease processes in the body that can make you more prone to having very early preeclampsia like that. They ruled all that out. So it was kind of like at that point, I started going down the rabbit holes and figuring out I need to know myself uniquely and individually and what my body needs. And so that's when I kind of started going down genetics and nutrigenomics. So, and started learning very quickly about myself, which this is a common gene that gets a lot of press. But again, it's one gene SNP that can make a really big difference in women with miscarriages. But it's the MTHFR gene, which basically means that those of us that have that gene SNP, if you're heterozygous or homozygous, you have much higher amounts or needs for B12 and folate. So I think that was part of my challenge with that pregnancy, is that I was very stressed out. I was eating more of a standard American diet, and we had just had some really big things in our life. It was the holidays, and we had just moved back from St. Louis to my hometown. So there was like a confluence of factors there for me. But so that very early on set the stage for me. Like I figured out how to help myself, how to optimize my health. And I went on to have 5 more successful pregnancies after that, and did not end up having preeclampsia, which I was told I would most likely and most certain have.
Mm-hmm.
So once I kind of got into the naturopathic and the functional medicine space, I knew that my calling was in infertility, and helping women, supporting their bodies pre-pregnancy and then helping them even get pregnant. Because, the statistics now are that 10 to 12% of couples are going to struggle with infertility. I honestly think it's much higher than that. Um, Based upon my own practice and what I see and who I talk to. But there is a very significant need for support in this community. So I actually, after I did my training, I did training through the School of Applied Functional Medicine and the Institute for Functional Medicine. I went on to train with Amatma Simmons. She's a naturopathic doctor that has specialized in infertility for the last 15 years. And so I did a year-long mentorship with her, with a small group of other healthcare practitioners, in learning how to support women through, infertility, in optimizing fertility. So that's how I kind of arrived here.
Mhm.
Um, and I'm so passionate about that.
That's amazing. Yeah. And like obviously a huge U-turn from where people told you you would be versus, I mean, 6 children is nowadays it's like, that's a lot, right? So it's
Yes,
clearly
absolutely.
you did something that was working for your body that allowed an environment where you could have as many as 6. And
Yeah.
so you mentioned you were eating a standard American diet,
Yeah.
and I think this gets thrown around, especially in the holistic, functional medicine, natural healing crowd. And maybe other people aren't exactly sure what that means because,
Yeah.
they're like, I don't understand. I just eat what I've eaten. Could you maybe just touch
Yeah.
upon what you define that as or how you see that diet?
Absolutely. So, like, back when I got pregnant, I was eating like peanut butter and jelly and like, Cheetos. And then I'd have an apple or carrot sticks, and I thought that was good.
Yeah.
That's like what most of us think. But, when I started digging into my genetics and found out, well, I've got MTHFR, which makes it really hard for me to process folic acid, and bread is full of folic acid. And I have more of a propensity to go down towards like an autoimmune dynamic. So for me, like I rarely eat gluten. And gluten and dairy are the two highest inflammatory foods that I coach people around. 75% of the world's population is lactose intolerant anyway, which means that the protein is too large for us to process. And dairy can be very problematic for people, especially when you add in the layer of the processing of it, the antibiotics that go into the food supply, and all of that. So that's when I started learning more about myself, and like I have also some gene SNPs that set me up for having real issues with weight. So at this point in time, I follow more of a Mediterranean style focused diet, which is heavy on like, wild caught salmon and like clean proteins and, you know, grass fed chicken, and like, also like more helpful oils such as like extra virgin olive oil, flaxseed oil, some of those that are better than like the cheaper vegetable oils that we see that are abundant in our stores, which create a highly inflammatory, environment, and make it harder for some of us that have not as efficient detoxification pathways, um, to eliminate the oxidative stress. So
Mhm.
yeah, so back then I was definitely, like when I jokingly say Ritz crackers, fudge rounds, like, I had that stuff. And honestly, I had been able to keep my weight really pretty
Mhm.
optimal because I was an athlete.
Mhm.
And, I grew up playing soccer, softball, and volleyball. And I did track too. So I was always very athletically minded. And like you'd find me on the treadmill or, out
Yeah.
doing something. But then when I started realizing, when we do exercise, we have higher nutritional needs. And when we're
Mhm.
eating, I want to say, and this is kind of a broad term, crappier foods, then
Yeah.
we're not supporting our bodies. So
Right.
yeah.
Yeah, that makes sense. And so Yeah, that's an awesome backstory on how that all unfolded. What do you feel like is the top three things that are causing infertility as you've been working with numerous clients over the years and helping them get to a page where they can get fertile? And the
Yeah.
back kicker to that question is it always the woman, or is it you have to work with the male counterpart as well, because they could be, their hormones and everything could be disrupted as well?
Yes, absolutely. So, with my couples that I do one-to-one coaching on, I also see the male partner
Mhm.
because let's be honest, to make a baby, it's 50-50. And ironically, like a lot of times they will start with women, like when there's infertility, and actually you can easily do a sperm analysis and right away see what's going on with the male, which is cheaper and,
Mm.
overall, like less invasive than what we do to women. So yeah, so in like for me, the overarching things that I see time and time again, which really seem to be common sense for most people, but like we don't think about this. Like when we're trying to get pregnant, we're like, we just think we should be able to get pregnant.
Mhm.
Is, the three biggest deterrents to health are those crappy foods that I talk about, this more of the standard American processed foods. Stress is huge. And stress doesn't just mean like mental emotional stress. It might even be stress from like a simmering gut infection, or it could be
Mhm.
toxins that are creating a stressful environment for our adrenals and thyroid system. um and the third one is the toxins, like the environmental toxins. And honestly, um I was just having a conversation with a couple of my colleagues, and we were discussing even like relationships with infertility is something that really needs to be looked at, because a lot of times, let's be honest, infertility creates a lot of stressors between the male and the female partner.
Mhm.
And sometimes there's trauma there, or there's things there that need to be dealt with in order for them to have a baby,
Mhm.
so that's another piece. So
Gotcha. And so
yeah.
how do hormones fit into those three buckets that you just mentioned? Like how are you
Yeah.
supporting, and what are hormones is like a high level, and then why are they so impactful?
Yeah, so it's a great question. And I coach a lot on this. So hormones are kind of the downstream impact of everything going upstream. So if we're busy like running from a Bengal tiger, like and our cortisol levels are sky high, like nature just in general is not going to allow us to procreate based upon that. So so looking at those food, like the foods and the stress and the toxins, that's all very, very important because that impacts the downstream hormones. And I always tell people, even that come to me like that want to lose weight, I'm like, the hormones and weight are like the last thing to come to shift into balance. You've got to go upstream and address all those other things first, before you can get a foothold on those things, and as far as balancing them. So, and I tell people that come to me, cortisol is our master hormone, and it dictates all those downstream hormones. And as a naturopath, from an expertise side of things, so many times I see people with very high cortisol levels, are very low cortisol levels. And, here's the thing: acute stressors for us can be a very good challenge. So, if you and I are working on a work deadline, we know by next Friday we need to get this done, like that, like increasing cortisol levels to get us to get get done what we need to get done and finish our work, that's all fine and great, and that's okay if it's excuse or acute. But what becomes really problematic is long-term cortisol levels, which we see this with higher blood sugar levels. Because what happens is, what our body is, whenever it kicks into gear and it's got to run from, the Bengal tiger,
Mhm.
our blood sugars are going to naturally go up and stay up. And then we're going to see more issues and imbalances in those blood sugar levels, which end up impacting and skewing our hormones downstream. So I hope that answers your
Mhm.
question there. But
Yeah, no, that's very helpful. And thank you for an eloquent answer once again. So, a couple other things. I know we're running out of time. We could do this probably for 6 hours and it'd be just as
probably,
interesting. Yeah.
yeah,
I'd like to address this because it does come up pretty often. So, a naturopathic doctor in some circles are called, quacks. There's nothing to them. It's witchcraft, or they're just stealing your money kind of thing. And then on the opposite spectrum, we have like people who are into holistic health, functional medicine, looking at the body as a whole, who call those doctors or that community just pill pushers. They don't care about the client. They just want to make money, right? And so obviously, I always like to say there's always something in the middle, and you can always learn. If people know my backstory, I've had 7 doctors of different kinds at one point, and all of them had a role to play, right?
yes,
So why do you feel like this has happened over the years, this animosity? And, I'm not saying this is everybody in each community. I'm just saying there are pockets of people that act this way towards each other. And I think all it does is create doubt and fear in people who are trying to get better, who want to go one path or another, or maybe both at the same time, and just kind of see what's going on, right? But then
yeah,
there's extra pressure,
absolutely.
like, I don't want my friends to know I'm going to a witch doctor, or like I'm not going to go to the doctor. They're just going to give me pills. And then therefore, and they're in this limbo state where it's like now the patient or the person who's not that well off in their health doesn't really have a good option, is more confused than ever. So what's your take on it, given that you've come from both worlds, transition
Yeah.
one way and the other, and have vast experience working in both industries?
Yeah, absolutely. So I always tell people to do a little bit of homework and go back to 1913 when the Flexner report came out, which was basically when naturopaths and chiropractors were kind of shunned. And the rise of MDs kind of became the standard.
Mm-hmm.
And so at that point in time, that was around the time when even pharmaceuticals were starting to come to be. And on the horizon was even vaccinations and all of these other things. So a huge part of that goes back to even MDs like 2 centuries ago were not making much money. So you can dig into that and kind of go down that hole. But I do think that was probably paramount in creating the divide between the MDs and the chiropractors, the naturopaths, even the acupuncturists, and more of the holistically minded people. And to your point, I mean, both sets of professionals bring a lot to the table
Mm-hmm.
in offering to support patients around what they need. For instance, tell people this all the time. Like, if I'm having a heart attack or a stroke, I don't want you to hand me an apple. Like, I want you to get me to the ER
Yeah.
where I have friends that are trained in emergency medicine and know exactly what to do.
Yeah.
I don't know that, and that's not my area of expertise. Even my daughter needed a surgery 2 weeks ago to repair a hernia. And you know what? I want a trauma surgeon doing that, not a chiropractor or a naturopath. So, unfortunately, that is a stage that has been set. However, the people that I work around and when I speak, I really help them to see the benefits of both, or like, all industries and what they can offer. And I really do believe, as a healthcare professional, a lot of it goes back to communication and making an effort. For instance, I
Mm-hmm.
had a patient last week that's got a gut infection. And honestly, I'm not a prescriber, so I send them back to their GI doctor and wrote a letter introducing myself, who I am, what I do. I found this on this comprehensive stool test. I think we need to address it. So it goes back to that, but a huge problem with that is, like you said, healthcare professionals, especially that are a part of the system, don't hardly have much time to even get through a 15-minute session or
Mm-hmm.
consultation with their patient. So that's where I have the luxury, because I've gone out on my own. I am not basically getting units counted for to account for my productivity. And so that's what I'm doing in my community, to kind of bring people together, so that they can see that everyone has a role to play in this. Everyone has wisdom and experience and training that can help other people. It's just how can we work better together to
Mm-hmm.
support our patients? So,
And so, what would you say to somebody who is trying to make a decision who to see? I could see a chiropractor, a naturopath, functional medicine doctor, an MD, you name it,
yeah.
right? I could follow a certain diet, keto, vegan, etc. So, like, how would you, what would be like your first step in discovery that you would advise somebody on how to make that call or do that research?
Absolutely. So I think that is having conversations, okay?
Mm-hmm.
And I have conversations with all with people all of the time that might not choose me as their healthcare provider, or their person to partner with, but I encourage them, whoever you choose, make sure that they hear you and they're listening and they're asking good questions. Because this is more about having a conversation than being told what to do.
Mm-hmm.
And that's where I really work to. And I have a blog, a very extensive blog, where I talk on many different health topics. And my team ties in research to empower people. And so, that's where I tell them. And like sometimes it depends upon what's going on with the unique individual.
Mm-hmm.
Because sometimes, like if it's a pelvic floor therapy that I think needs to be done, I'm going to refer them out to one of my friends that's a physical therapist that can address it. And I know that they're experts in that and they can do that.
Mm-hmm.
Sometimes if it's spinal related and or something else that I know my local chiropractors can help support, then I'll, make that recommendation. So,
Gotcha.
yeah, so that's probably my best response to that.
Okay, awesome. Okay, so I know we're running out of time here, so we'll do maybe one more question and then we'll do a quick wrap up.
Sure.
Last thing, with all the experience and the clients you worked with, is there one common thing that is kind of like the best, or is there, sorry, let's put it this way. Has there been one common theme between everybody you worked with that has been an issue that you could maybe address or kind of talk about a little bit? I know we can't get into a tremendous amount of detail and there's context around every unit of health and each individual is different, but like, has there been one common theme that you've seen? You've talked about a lot of things, diet, environment, maybe this trauma, etc., that everyone's
Yeah.
had that you worked with, or is it really, really kind of dependent?
I think for me, like the people that come to me have gone to many different practitioners and doctors, and they have dissatisfaction around their results and what they're getting from those relationships. So, and that's where I think people find me and they really recognize, even though like I'm an expert in my field and in many things, I firmly believe that the client is the expert on their own health.
Mm-hmm.
So I provide the resources, the inspiration, the empowerment, and help them, with a partnership with their other healthcare providers. And I think we're seeing that more and more, is that, people have recognized that paying their copay is getting them suboptimal health. They're not getting like, I had a client last week who wants to lower his blood pressure, and he's like, nobody tells me what to do. Basically, they just tell me to lose weight. And it's always that. And then they'll tell people to change their diet, but they don't even know where to start because
Mm-hmm.
let's be honest, there's hundreds of dietary theories out there. And so that's where I do precision medicine, and I use testing, and I do a comprehensive health history with people, to really learn more about them, their family history. like, what they've been through. Cause like every person has
Mhm.
their unique experiences that impact their health. So,
Amazing. Yeah. So if I got that correctly, the common thing is you need to figure out what's going on, right? Because
yes.
it's a spectrum of things. I think we both agree it's never, oh, we can just plug this hole and then we're good, you know.
No, I tell people
So
over and over again, I'm like, if you're coming to me for health, you're not going to get the quick fix. So I'm not going to give you the pill and send you on your way. Like, we are going to work to peel back the layers of the onion of your health. And many times that goes back to when they were born. Like, I
yeah.
mean, people don't realize this, but how you were born and what your mother, if she did breastfeeding or bottle feeding back in the day, really sets the stage for your health 30, 40, 50 years down the road.
Mhm.
And so really just digging into that and peeling that back is really important.
Gotcha. Okay, awesome. Any last words before we hop off and finalize that you wanted to bring together or say?
I don't think so. I think the biggest thing that like I just suggest for people is to be your own health advocate. Don't give up. If you're going to, physicians or other healthcare providers that aren't listening to you, there are people out there that will listen to you. And so serving from a place of inspiration and empowerment, it might take you 3, 4, 5, 6 people to find your person, but be it a chiropractor, be it an acupuncturist, a nutritionist, a physician, don't give up because, that's where you come to a place and just feeling defeated. Um, and, just doing your own research is so important. So,
Awesome. Very cool. Thank you, Mandy. So before we wrap up, Mandy, where can people find you? What's the best place to contact you and check out your body of work and see what you do and how you work with others?
yeah, absolutely. So my website is www.mandypatterson.com. So pretty simple. And I am out on Instagram as M Mandy Patterson ND, like naturopathic doctor. And also on Facebook as Mandy Patterson Functional Medicine Practitioner. So that's the best place to find me and reach out.
Amazing. For everybody, just go follow her right now. We've put the links on the bottom. Obviously, a wealth of information, expertise. Been doing this for a long time in every single aspect of this healthcare industry. So really unique perspectives. As everyone has seen watching this, very unique answers that obviously are rooted through experience and learning at the same time. It was a pleasure having you on, Mandy. And we obviously enjoy working with you very much. And we want to thank you for taking the time to do this.
Absolutely. Honored to do it, Boris.